Welcome to Life-Saving Tips, a virtual event brought to you by Maybank and Etiqa. My name is Terrence. As the saying goes, life is full of surprises. Some of them may be like a box of chocolates, and others may be pretty unpleasant. Heart attack and stroke can occur at any time and any place and strike any one of us without warning. However, there are some unusual signs and symptoms that we often neglect to recognize that may be crucial in helping us render that much needed aid and also potentially resuscitating someone. Today, Dr. Mohammad Fikri will help us identify some of the symptoms associated with heart attack and stroke and also share about that golden period that may be crucial in helping us save a life. Ladies and gentlemen, let's listen in to Dr. Mohammad Fikri, Resident Medical Officer, Accident and Emergency Department, Gleneagles Hospital Kuala Lumpur.
Hi, I'm Dr. Fikri and I'm from Gleneagles KL. Heart attack and stroke is the first and the third most common causes of death, respectively, in urban and rural area in Malaysia. The risk is higher in male, in smokers, in people with diabetes, hypertension, and high cholesterol. It occurs when there's a blockage of the blood vessels that carries oxygen to the brain and to the heart. This causes starvation of cell and all the symptoms that comes with it. Starvation of oxygen to the heart muscle will cause you to have chest pain, chest heaviness, and these symptoms will be usually associated with shortness of breath, sweating, dizziness. Sometimes you can come with seizure and fainting episode. But this is not always the case. If you are a diabetic patient, a long-standing diabetes, you can come with only a symptom of lethargy, no chest pain at all. We call this silent heart attack. Stroke is straightforward, because stroke, the symptoms is muscle weakness or sometimes numbness as well. And it always comes one-sided. We have a mnemonic for that. F, A, S, and T. We call it FAST. F is for face, A is for arms, S is for speech, and T is for time. For F is the face. Look at their face, the symmetry of the face. Ask them to smile. If one side of the lips is crooked, they might be having a stroke. And for A is arms. Ask them to raise both of their hands up. If they are unable to raise one side of their hands, this is a sign of stroke. And for S, which is speech, just talk to them. Ask them their names or ask them anything. See whether they can reply you. If they appear confused, if they are unable to answer your question, if their speech is slurred, this is a sign of stroke. And T is time. It's time to call ambulance. There is one common pitfall that I notice in most of my patients who come in with heart attack and stroke. And that is they come in too late. I call this patient delay. When they come in too late, the effect of the heart attack has been so massive that renders their heart too weak to sustain a normal life. And in the case of stroke, if they come in late, the brain damage has been so massive that it affects their daily activities so much that they might require assistance for the rest of their life. So how do you survive heart attack and stroke at home? First, you have to understand that time is the most important factor to be considered here. The treatment for heart attack and stroke is to minimize the damage that has been done since the first onset of the symptoms. For heart attack, it is best if you come within the first 60 minutes of the symptoms of chest pain, because it will only take us 5 minutes to know whether you have a massive heart attack or not. And in the case of stroke, it is best if you come within the first 3 hours since the first symptoms of stroke, because it will only take us about 15 minutes to know whether you have a stroke or you don't have a stroke. If you're having the symptoms of heart attack, what should you do? First, you have to remain calm, because the more nervous you are, the more extensive the damage of the heart attack will be at your heart. If you are a known patient of a heart disease, if you have been instructed by one of your doctor to take any type of pills, if you're having the chest pain, take the pills and still remain calm. Get help from anyone, from your neighbors or bystanders or any passerbys. Tell them that you're having the symptom of heart attack and that you need an urgent help. It is not advisable for you to drive yourself to the hospital. You might suffer cardiac arrest while driving yourself to the hospital. You might endanger other motorists and also yourself. The best way is get help or call ambulance. Anyone out there, if you witness someone having symptoms of heart attack or stroke, the best thing that you could do is to ask them to remain calm. Help them to get what they need and bring them to your nearest emergency room. But if they are unconscious, check for their pulse. If they still have a pulse, lie them to their side and then call the ambulance. But if they don't have a pulse, start doing CPR if you know how to do one. If you live in Klang Valley or in a big city, it is best if you already know which hospital has the best specialty to manage the case of heart attack and stroke. A hospital that has a cardiologist and a neurologist is a hospital that is best to manage a case of heart attack and stroke. But this should not delay your journey to the emergency room. You might have heard that poking the tips of your fingers help in the case of stroke. This actually does not help at all. This will just delay your arrival to the emergency room. The difference between a normal chest pain and a chest pain that is caused by the heart is that the characteristic of the pain itself. Most common cases of a heart attack, they will describe the pain as chest heaviness, and they will have a lot of sweat, and then there will be dizziness, shortness of breath, and the difference is that the patient will have this sense of impending doom. They feel like they want to die. This does not have in other kind of chest pain. You know, like pain, if you bang your fingers on the wall or if you hit your head on the wall, you will not feel like you want to die. But in chest pain that is related to the heart, they will feel like they want to die. You will feel that, you will see that they are so pale, they are sweaty. This is how you differentiate between a chest pain that is caused by the heart or a chest pain that is of other kind of causes. The causes of it is a blockage. Once the symptoms happen, the damage is already there. So the treatment of stroke and heart attack is just to minimize the damage that has been done. So if you are late, the damage will be bigger. In cardiology, they call it time is myocardium. Myocardium is heart muscles. So if you are late, the damage is so massive. And same goes to stroke. If you are late to the emergency room, see, since the first signs of the symptoms, the damage is already there. So the more time you take to go to the emergency room, the more damage it will be. That is why you need to go to your nearest emergency room as fast as you can. That is the only way that you can do if you are experiencing any of the symptoms. If you are living with a survivor of heart attack and stroke patient, the best thing that you could do is to be there with them, give them moral support, and make sure that they understand the condition that they are in. If you're taking care of patients with stroke, you have to know the extensive of the damage that has been done to the brain. We are talking about the very mild symptoms to no symptoms at all to a very severe symptoms that renders the patient unable to do anything at all. So in a very mild symptoms, if the patient can still be mobile a bit, you will have to ensure that all their basic needs is within their reach, and you need to have something like a handrail in the bathroom, because most of them, the biggest risk is they fall. They tend to fall, and if they fall, they will have a very bad fall. They will have some fractures. Some of them even fall to their death. If you are a patient with a previous history of heart attack and stroke, what do you need to know? You need to make sure that you control all the diseases that you have, because most of the patients with heart attack and stroke, they tend to have diabetes, they tend to have hypertension, and they tend to have a high cholesterol, and they tend to be obese. These are the modifiable risk factors that they need to adjust. All the medication for heart attack and stroke is actually to prevent a second event of heart attack and stroke. So if they don't take their medication regularly, if they don't make sure that the risk factors is adjusted accordingly, this will make their symptoms worse. So in conclusion, recognize the early symptoms and don't miss the golden period. This will save your life.
Thank you, Dr. Muhammad Fikri, for that sharing. And also thank you all for watching. We hope this has been educational to you. I'm Terrence. Thank you for being here with me, and make sure you stay protected with Maybank and Etiqa.